The Health Advocate program started in 1989 in one residence hall, Pioneer Hall. There were 4 students who served as health advocates, and the program started because students would find themselves not feeling well, not sure where to turn, and they would go to the hospital.
Res halls are really close to an emergency room over at the hospital, and so they were getting a big number of students that were coming in for things that were really pretty minor into an emergency room.
However, their concern could have been handled much more quickly and easily by a student who was trained and available in the residence to help them out. So that's how the Health Advocate program started, and it has expanded to all residence halls at the University of Minnesota, most fraternity and sorority chapters at the University of Minnesota, and some private apartments.
They were busy right from the start. They always, saw a lot of cases, and a lot of things were minor, but then every so often they would have something that was really, quite serious. There was one Greek house. It was a fraternity, and they were having a party, and one guy was pretty intoxicated, being really obnoxious, and so some of his frat brothers, they wanted to just get him up and put him in bed, and hopefully he would just sleep it off. So they brought him up to his room, and they were tossing him in his bunk, and he hit his head on the bunk and got a cut on his head. So they called the health advocate to come up and treat the cut. Well, the health advocate is looking at this guy and treating the cut, but he notices, wow, he's really kind of going downhill fast, and asks, well, how much do you have to drink, et cetera. And so at that point, it looked like this particular guy was experiencing acute alcohol poisoning, basically. And so they ended up calling 911, and we're really glad they did, because he ended up spending 5 days in the hospital and was really quite sick. He had a lot to drink.
As a health advocate, I saw a lot of first aid related scenarios. So students become injured while riding their bike to class, or they slip on the ice and hit their arm. I helped a lot of students with a lot of first aid needs, such as a scraped arm or a broken bone, or perhaps, they skinned their knee. I helped with a lot of those sorts of things, as well as a lot of cold symptoms, a lot of helping students figure out, do I need to go to the doctor for this? Or, hey, I've never had to care for myself before. I usually ask my mom what I should do about this. So, what can I take for these symptoms? I have a headache, I have a runny nose. Do you have anything that could help with this? And so helping students through those sorts of encounters has been really impactful for me.
We're here to help support students get through college so they can get that degree. We know that health can get in the way. So in other words, problems with health can get in the way of graduating from school. This is a first year students live in res halls. And also they tend to be younger too, not necessarily first year, but living in some of our Greek houses too. And this is a great opportunity to keep focusing on helping them get through school.
Health is something I've always been really passionate about. I grew up wanting to be a nurse, but I wanted to see health from a different lens, particularly on the campus, in the campus community. And the Health Advocate program really helps you to learn about public health and see the health issues that impact university students and the specific health needs that we have as a population. And so I wanted to be a health advocate to really make an impact and learn about all of these different topics that I maybe wasn't super familiar with coming into it.